Hello, everybody, and thanks for joining. Welcome to Revive Health's Daily Briefing Live for Thursday, May 28th. This is our 30-minute review of the latest, most important news, resources, and advice for health system marketers and communicators who are dealing with COVID-19. My name is Sasha Bogosian, and I'm joining you as your guest host for today's show. I'm joined, as always, by Chase Kleckner, who's our Senior Marketing Manager at Revive Health, and our show's producer. Hey, Chase, how are you?
Hey, doing well, Sasha. Good to have you on the show.
Oh yeah, I'm excited to be on this end instead of on the guest end. We'll see how this goes.
That's right.
Great. Today we're joined by Tiffany Pack, one of our great colleagues. For more than 10 years, Tiffany's been focused on helping healthcare clients tell their stories effectively and authentically. Tiffany serves as strategist and account lead for many of our clients. She oversees brand strategy development, marketing campaigns, and crisis communication strategies as well. And prior to joining Revive, Tiffany led efforts across marketing, patient engagement, and strategy for companies like Change Healthcare and MD Life. Hi, Tiffany, how are you?
Tiffany, I think you might have been on mute there.
Yeah,
I said, great, thanks. Thanks very much.
Good, glad we could have this chat together today. As with each show, we'll plan on covering the latest news on COVID-19 and how it relates to marketing communications. We'll highlight helpful resources, share what we are seeing and hearing from Marcom professionals across the industry, and as always, open the floor to questions. And as we move through the show, if you do have a question, please use the Zoom queue to ask it, and we'll get to as many of them as possible. During this session, you can also chat with other attendees using the chat function. But again, if you have a question, don't do that and use the chat function so that we can get it in the queue and answer it as best we can. In that chat function as well, we'll provide any relevant links that we talk about on the show, like news clips, updates, that sort of thing. Just a quick reminder, you can subscribe to the podcast on iTunes. Just search for Revive Health Daily Briefing Live, and we'll be posting a recording of this episode by the end of today. You can also visit us at thinkrevivehealth.com/COVID-19 for that. And that's also the hub where we post all kinds of other content that we're developing for this crisis. A couple of really important notes before we get going. First is that we're not medical experts on COVID-19, so this is not the place to come to for medical or scientific advice or resources. As marketers, we do have lots of opinions, and we'd like to think some expertise on how marketers and communicators might want to manage the COVID-19 crisis. Obviously, your situation, depending on what market you're in and depending on all kinds of other factors, is unique. And at the end of the day, you have to make your own decisions about how you manage the crisis in a way that's best for your organization. But we hope that the resources and conversation that we're providing can be really helpful too. So let's begin. As always, we start with the latest counts. It's really important for us to sort of start with that as the context. It gives us a sense of how the crisis is growing, both in the US and globally, and hopefully sooner rather than later, how it's going to be receding. And that context is really important as we think about what we ought to be doing and how we ought to be doing it. We use the data that's reported by Johns Hopkins through their online dashboard. And as of this morning, their case counts throughout the world is at 5,727,629. And the death count globally is 356,435. In the US, more specifically, they're reporting the case count at 1,702,911. And really sadly, we seem to have crossed a pretty significant and tragic thresholds with the death count here in the US crossing 100,000, and the specific number being reported there is 100,576 as of this morning. We're seeing the numbers sort of in different phases throughout the country in different markets. Here in Los Angeles, where I am, we still sort of seem to be in the middle of it, and the numbers are fluctuating from day to day, but there have been some sort of slow movements toward gradual and phased reopenings. I'm sure that the markets that you all are in are experiencing some different versions of that. Obviously, the local numbers for us as communicators are much more important and significant in informing and determining what we're saying and how than the national and global numbers. But hopefully the broader numbers give us a sense of where we're at with this crisis, sort of as a global and as a community and as a nation. Really quick, just a reminder to visit our communications hub. We beyond posting recordings of these sessions, we provide a significant amount of content there. Just yesterday, we posted our bi-weekly roundup of intel and advice, and you can find that at thinkrevivehealth.com/COVID-19. Yesterday, we spent a lot of time internally scouring the news and sharing news clippings. Yesterday, there was an interesting clip that got circulated. It was through RevCycle Intelligence, and it covers some research that the Healthcare Financial Management Association, or HFMA, has recently done, surveying health system CEOs across the country. A couple of really interesting pieces of news there so that you all as marketers and communicators can sort of get in the headspace of your C-suite. Most of them see a significant amount of time still passing before OR volumes are able to return to where they were at before the crisis hit a couple of months ago. From their perspective, the sort of majority view is 6 months or more. So really looking at going through the rest of this year with OR volumes continuing to be significantly down, and maybe spending some of next year even trying to sort of climb back and restore volumes to pre-crisis mode. And a significant number of the CEOs surveyed also said that they anticipate that the annualized hit to their revenue is going to exceed 30%. Again, it's not earth-shattering news, because I'm sure you all are sort of familiar with all of this. But again, from the perspective of sort of operational leaders, that's kind of where their headspace is at, and that's where they're going to be laser focused throughout the rest of the year in figuring out how to sort of claw that back or minimize any more sort of ongoing revenue hit. And that's kind of what we're experiencing on our end, as well as we talk to clients, health systems big and small across the country. So onto the day's topic. I think this is a really important and timely discussion that we're going to have with Tiffany today. We're starting to see what we would describe as transitional messaging happening across the country. So as we've talked a lot on this program, we really view the narrative around COVID from a communicator's perspective really in 3 phases. The first being crisis response. You've all been there, sort of deeply entrenched in it for the last couple of months. This is where your organization's message is really focused on patient safety and what they can do to sort of keep themselves and their family safe by staying at home, by protecting themselves in all of the ways that we're familiar with. The second phase really is this phase that we call rapid recovery. And the message and the narrative around that is a little bit different than the response message. And today we're really going to focus on how we're seeing that transitional message come to life with clients across the country. We're starting to see sort of very slow but methodical movement that's getting into that transitional messaging, where the nature of what we're talking about is shifting from sort of a stay safe core message to one that's sort of reaching just a little bit beyond COVID and talking more about us, our readiness, and our ability to see patients who need healthcare services safely. And Tiffany at Revive has really been on the forefront of that, advising clients on how to sort of navigate that transition. So Tiffany, I'd love to hear your experience, sort of where you're at with that transition message and what you're seeing and what the timing around that looks like.
Yeah, thanks, Sasha. Yeah, I think, we're seeing in our own research, and then certainly the research that we're just seeing out broadly, that consumers are pretty nervous about coming back for care at this moment, even if care is available. We're also seeing that they are foregoing a lot of the care that they should be getting. So we're in this kind of interesting phase with hospitals and health systems where we're trying to move, as Sasha said, from this point of safety messages and stay inside and wash your hands and 6 feet apart and all that sort of thing, which we've pretty much pounded into everyone's brains at this point, into how do we get people to access care when they really need it, after we've told them kind of stay away from facilities and that kind of thing, because we're focusing on COVID. So a lot of the work that really needs to be done out there now is kind of getting people feeling comfortable with where we are in the evolution of healthcare post-COVID, and then encouraging them that just because we treated COVID patients in a facility does not mean that you're going to get COVID-19 if you walk into that facility later. So I think a lot of it is really this big concern for patients and people who are not getting the care that they need, and trying to address that at this point.
Yeah, that makes sense. I feel like no matter who we've been talking to across the country, we're sort of hearing about demand that we know is out there, but sort of is starting to sort of express itself in different ways. And that's maybe a nudge to us that the market or our community out there is sort of ready to hear a different message from us. So speaking of that, how did you decide that the time was right to start sort of venturing into this sort of transitional messaging?
Yeah, I mean, I think we're seeing a few things. I mean, it depends on the market and kind of what the stay-at-home orders are in different states and different local markets as well. But in places where things are starting to loosen up a little bit, there's this big surge and big desire and kind of a feeling of panic to some degree from clinicians, from administrators, because we've got to make up kind of lost time from a revenue standpoint, but also again, some of the things that I said earlier about getting people who need care into care. So some of it is that, some of it is just like, okay, we can do this now, we're opening back up. But yeah, it's been more kind of a combination of those couple of things, and really trying to guide our clients, not to kind of jump and do something kind of in reaction to what they're seeing in the market with maybe competitors or that sort of thing. But also just to be very kind of planful about how they move into this next step so that it makes sense and doesn't feel like a knee-jerk reaction.
Yeah, that makes sense. From a timing perspective, have you spent time with your clients talking about sort of how long this phase of message will sort of be relevant in the market? What's the time horizon that you're looking at as you think about this next narrative that you're getting into?
Yeah, so I mean, the next narrative, just to kind of give the folks listening kind of an idea of what we're really talking about here, is all about, yes, it's safe to come back to healthcare. Yes, you should be getting the healthcare that you need. These are the specific service lines that are open and available. There's different ways to access care, all of that. So as we're looking at it with our current clients who are moving this direction, we're really, none of us really knows what's going to happen next with COVID-19. There's the potential for surges. There's been a lot of press about, a more imminent surge maybe in the fall, depending on the seasonality of this disease, that kind of thing. So really the way that we're approaching it is, how can we put something out there that works now, kind of in a construct that works now, but that we can use to kind of move the message along depending on what that message is, what that message needs to be. So the way we're really looking at it with clients now is, we're going to go ahead and do this reassurance piece of messaging in the market currently, but we're going to evaluate every 30 days or so, depending on what we're seeing, with the disease, how things are happening with reopening metro areas or states, and just really be agile and nimble and build things that that are agile and nimble, but that can carry us through with a brand that provides reassurance.
Yeah, you mentioned earlier this sort of possibility of resurgence that's very real, that we're facing. To what extent have you sort of scenario planned that out with your clients, and to what extent are you sort of making those messages ready so that you can sort of return to the resurgence related safety messages
Yeah. Yeah, I think we're kind of, we're looking right now with clients at a number of different scenarios. What happens if we get spikes in the summer? What happens if the whole thing goes away and we can just kind of go back to something that's more life, as normal? What happens if we get the scenario again, during flu season, or how do we plan for all of those things? And depending on the client and the client situation and how severe they were hit by the pandemic initially, in some cases, we're using the very same kind of overarching brand campaign construct that will carry us through and be able to deliver upon those messages. In some cases where we had a very strong campaign that still aligns from a look and feel standpoint with the overarching brand, but where we had a strong campaign that was very focused on kind of your personal safety, staying indoors, 6 feet away, wearing masks, all that sort of things, we may resurrect pieces of that as we move into these different scenarios. But definitely planning for all of those. I mean, better to be ready for all of that and, not have to use it, certainly. So
that makes sense. I'd love if you could, for you to talk a little bit about so the positioning in the message that you're going to be going in market with, specifically with one of your clients later this week. In the conversations that you and I had, I thought it was really interesting that the way you're sort of positioning the message, it harkens back to existing positioning and even an existing narrative and sort of pivots it to make it relevant. But it's not like you've sort of gone net new in terms of how you're talking about your organization's value post-COVID. So I thought that was really interesting.
Yeah, so what we've been able to do with the client that Sasha is referencing is really to look back at a very strong campaign that they've had for the last couple of years, but that had a slightly different meaning, and to bring that up and really focus it toward the community to make it a very kind of community focused message that is that kind of takes the focus off of us. Although we do want you to come back for healthcare, it's really more about kind of getting out into the community, leading, being that voice that people trust. We learn from our own research that people within really all the markets really were looking to the local healthcare systems as the people to follow and to trust. And so we really want to position our folks as the leaders, as the confidence builders, and in a campaign that can not only be good for now, but that can carry them through the rest of 2020 and maybe even into part of 2021, depending on what we experience.
Sasha, you're on mute.
I sure am. I think that's really interesting that the way you all have built it, it feels reassuring to be able to sort of get into a message that doesn't feel completely new and that's sort of tied back to what you all have been used to talking about before COVID. So that's kind of an interesting approach to it. I'm curious if you can talk a little bit about how you're going to bring it to life, channels, particular ways that you're going to try to engage your different audiences.
So the market for this particular client is still very traditional media focused. So we'll be doing certainly a lot of that, but then the digital end of it, and then how do we tie that into other places that people search for care? So some of the other iterations that we're looking at doing with this particular client is not only kind of getting out there as, here's who we are, here's all of this, but is there a Q&A or some sort of mechanism for people to be able to come in and ask questions and that sort of thing. So not only on our kind of owned media, but really looking at traditional, digital, all of that. Probably should also say that virtual care, telemedicine is going to play a big part of this as well. So making sure that we are connecting to audiences who are looking for care in that modality as well.
Yeah, that's a really interesting issue, because I'm sure that if your client is like most health systems in the country, virtual health wasn't a big part of how it talked about itself in the market. So how has that changed, and how are you planning on talking about it now, sort of post-COVID?
Yeah, dramatically. As we've seen in media kind of across the country, the surge has been the surge of COVID-19 has really driven a surge of usage of telemedicine and virtual care in general. So the interesting thing with the client that I'm working with is that they have some unique characteristics. One of which is that they don't rely on physicians outside their hospital system, outside their system for virtual care. So when people come to them, they're actually coming to a physician in a system that they already trust. All of that information is connected. So if they have a primary care physician in the same system, that person's getting information, et cetera. They are also tying pharmacy to that as well, so that you can have not only have a virtual visit with an urgent care kind of person, they can also send a prescription through to their pharmacy and have that delivered directly to your home. So it really is truly virtual care. You don't have to go out and take any kind of risk, which works great for people who maybe are in more sensitive situations with respect to COVID, or who are really concerned about all of that. So.
Yeah, that is really interesting. You might not necessarily know the answer, but I'm curious if all of that operational infrastructure was set up and in place and working really well before COVID, or if there was lots of development happening in the last couple of months.
I think most of it was set up and in place previously. It just wasn't being utilized, just like we've seen across the board with telemedicine. I think we've all been waiting for that tipping point. I think we talk about it at the beginning of every year. This year is the tipping point for telemedicine, and this year was the tipping point for telemedicine. So they had the infrastructure set for the most part, and then now it's like, wow, hey, it really works. So
it finally happened. We can talk about it.
Yeah,
that's really interesting. So beyond sort of talking about your own organization and sort of its readiness to see patients that need care, I'm curious, to what extent are you using this sort of transitional narrative to tie back to community leadership, to talk about elements that are sort of outside of immediate clinical issues?
Yeah, absolutely. And 100%, we are definitely using this campaign to do that. Again, if we hearken back to some of the research that Revive did early on, and we heard loud and clear every time we surveyed people that they really are looking to local health systems for leadership, not just about the clinical side of it, but just, how do we get beyond this moment of, we're kind of locked down and not able to do anything, to getting your child back in school in the fall, or, how do we go outside and enjoy ourselves? So there's just a lot of very really, really relevant places that COVID has opened up for local health systems to play a role in. And this is just, it's a fantastic opportunity to really be that leader that brings the community, out of this crisis.
How have those conversations been with leadership? Have you found yourself having to sort of convince them to step into that role, or have they been pretty willing and open about it?
It's funny because I think everyone in a couple of different situations going in, people are a little bit hesitant about, if we go this direction, what's leadership going to think? And where we've convinced people to go and have the conversation, leadership has been remarkably on board and enthusiastic about it. I think they really see this as an opportunity to kind of become more trusted, or have a perception of greater trust from consumers and patients, and also just to kind of play a bigger role in the community in general. So by and large, virtually everywhere we've taken it, people have been super enthusiastic about this idea.
Yeah, that's great. In my own experience, it's been similar, that maybe just thinking about sort of taking on a much more visible, larger community role as a healthcare organization seems a little intimidating, but it's a very sort of natural transition and space that even our research tells us we have all the credibility in the world to step into. So I'm glad you're finding receptive clients around that.
Absolutely.
I know we're going to run up on time soon, but before we finish, I'd love for you to talk a little bit about your objectives with taking this part of the narrative to market? Or what are some of the markers that you're looking at in terms of measurement? What are you all trying to achieve? Have you really focused the conversation around how you're going to be tracking this?
Yes, we have. I mean, certainly, patient retention is a thing that everyone is talking about from the standpoint of, how do we keep the people that we were already caring for, or with whom we had to delay care early on? How do we keep them in the system? But then also, is this an opportunity because we are, being leaders in the community and really taking on this role? Patient acquisition certainly should be one of the measures that we're looking at as well. So all of those things, how are people coming to visit the resources that we are providing? What kinds of questions are we getting? What kind of volume of questions are we getting through some of those channels, et cetera? Doing a little bit of work in and around individualized URLs so that we can see from a digital standpoint what's tracking well with consumers. So yeah, just a combination of those things, but certainly at the forefront would be patient retention and acquisition measurements.
We did actually have a question come in if we want to dive into that question. So
Sure.
We had one that says, how are your clients assisting local businesses open up in this time of rapid recovery or kind of the next phase? Do you guys have general advice, on-site assistance with temp screening, any kind of other ways that health systems are getting involved with local businesses as far as opening back up?
Sasha, do you want to take that one, or yeah?
I don't have any firsthand experience in this. I'm not working with health systems that are taking a really active role, or I should say a proactive role, in sort of getting involved with helping businesses prepare to reopen. To the extent that I've been reading about it, it sounds like it's sort of all over the place, that the experience that you can expect walking into a reopened business can vary pretty wildly in terms of what's going to be required from you. Some have really stringent requirements, which might necessitate some sort of a healthcare organization partnership if they're taking temperature screenings and doing all of that. But generally speaking, I haven't spoken to a lot of health systems that are intimately involved in partnering with businesses to help them open up.
Yeah, I would say too, I am working with one academic institution where kind of earlier on in the process, they went out and helped other kind of clinics in the area, kind of federally qualified health centers, that sort of thing, understand how to sanitize and do those sorts of things. And they're also putting out recommendations for just safety in the different situations in the community, working with the state and local authorities to make sure that that's getting done appropriately. So, but beyond that, I don't really have any specific experience with that either.
Great, thank you. It looks like we're running up on time. So Tiffany, thank you very much for joining. I think this is a really timely conversation that a lot of the folks that have joined us today are probably having within their organization. So the insight that you were able to provide is really helpful to a lot of people, I'm sure.
Yeah, thanks for having me.
You got it. Okay, that's it for today's show, everyone. Please let us know if there's something you'd like for us to cover tomorrow by posting it in the Zoom chat tool. And tomorrow we'll have Jared Usry joining us as guest host alongside Alan Shoebridge, who's the Director of Marketing and Communications at Salinas Valley Memorial Healthcare System out in California, where I'm dialing in from. Remember to visit thinkrevivehealth.com/COVID-19 for a recording of today's episode and of all of the content that we have been publishing related to this crisis. You can also subscribe to this podcast on iTunes, and please remember to let others know about it if you found it helpful. And as always, to all of you out there, hang in there. Thank you so much for all the work that you're doing. Keep it up, and the skills that you're bringing as marketers and communicators are absolutely essential in helping your organization move through this crisis. So we really appreciate it, and we hope that you can hang in there. We'll be back tomorrow and every weekday until all of this passes. And until tomorrow, we'll have a great day, and we'll see you soon.
Bye, everyone.